name is Haley Wingeter, and today I will be discussing the diagnosis of autism in the different sexes, as well as general information on the disorder. Now, first off, autism is used as an umbrella term for 5 different disorders, including the autistic disorder, Asperger's syndrome, persuasive development disorder, childhood disintegrative disorder, and Rett syndrome. In 2000, these were all characterized together as known as autism spectrum disorder because of common symptoms and treatments. Now, the autism spectrum disorder is a developmental disorder of variable severity and is characterized by difficulty in social interactions and restrictive or repetitive behavior. The spectrum goes from high functioning to low functioning based on the DSM-5 score, which is levels 1 through 5, 1 being the low functioning, which is characterized by childhood disintegrative disorder, and high functioning, which is more towards the lines of the Asperger's syndrome. Now, the problem with this type of spectrum is that some believe it's based on a personal belief, but most of the time it's used in medical categorization of the treatment as well as the actual disorder or severity. Now, going on to a couple of statistics about the autism rates. So 1 in every 160 children will be diagnosed with autism. That is 0.6%. Now, going on to the differentiation between males and females, for every 1 female, there's going to be 4 boys that are diagnosed. Now, this takes into consideration that means that 0.3% of all the females are going to be diagnosed with autism, and 1.2 will be diagnosed in males. Going on to the actual diagnosis of the two, so diagnosis of autism in males, the symptoms present between 12 and 18 months and are very usually caught because of the attention to detail in infants. Now, some of the symptoms include short attention span, lack of eye contact, narrowed interest, and sensitivity to stimulus. While this is caught very often, the diagnosis goes between 3 and 5 years. Now, this is a 1.5 year gap where the symptoms can either persist or they could fall away as the children get more socialized, as well as their interactions and communications begin to better themselves. This can also be helped through their interactions with their parents and their siblings if they have any. Going on to the diagnosis of autism in women, which is very different. The symptoms tend to present differently in females and also can be masked. And for this reason, females usually do not get diagnosed until later in life. The average age for the diagnosis in women is between the ages of 16 to 20 because of one specific symptom that occurs, which is the masking ability. Masking ability often presents only in females and is characterized by the ability to realize that there are differences in communication and their social interactions and be able to mask their actual diagnosis and present themselves as someone who has the ability to have these social interactions instead of having the autistic symptoms. From there, it's also hard for females to be diagnosed because autism is most greatly influenced by the amount of testosterone that is in the body, and a lot of the assessments are made for men in that testosterone. While the levels of testosterone in women are going to be lower, they're actually not registered on the assessment, which is called the extreme male brain theory, which is the difference between the testosterone and the estrogen in women than the testosterone and estrogen in men, which can actually be a presenting factor, especially looking back to the 1940s, whenever Hans Asperger actually published that females could not be autistic. While he took this back, there have been many that keep this in actual standings. But as we can see, the amount of females that have been diagnosed have actually risen from then. In 2015, the ratio was 5-1, and now in 2019, the ratio was 3-1, showing the advances in medical abilities, and the realization that females are able to be diagnosed with autism. Overall, we looked on the spectrum of autism and how it became, and the different diagnoses that are under that general term, as well as the diagnosis in men, the diagnosis in women, and the differentiation and problems between the two. Thank you, and have a great day.